Hi, everybody. This is Carolyn McMakin. This is the frequency-specific microcurrent webinar for May 15, 2018. It's always exciting to use a new platform, so apologies for being a little bit late. We're going to do something a little bit different with this webinar. A lot of people wonder when they look into frequency-specific microcurrent, how do the frequencies actually work? What do they do? What does frequency-specific mean? So when we use frequency specific, how do the frequencies work and what are they doing? Answer to that question comes from what we've done with frequency specific microcurrent in the last 20 years, 22 years actually. The first time I ever used the frequencies was 1995. Got serious about it in 96, started teaching it in 97. And between 1997, so in 21 years, we have produced a fair amount of data and hundreds of thousands of patient case reports and experiences. So how the frequencies work will affect what frequencies you use and why and how you use them, okay? So where did the frequencies come from? Well, back in the early 1900s, about probably starting about 1906, 1908, there became a widespread interest in the United States and England in using frequency-specific therapy and in using electromagnetic therapies in general. They were used very widely, probably 2008, 2010. The Flexner report came out and said that, hey, drugs and surgery and practice of medicine, we really have to standardize medicine. And everybody pretty much ignored it. In 1917, they got more serious. 1924, they got more serious. And in 1934, the American Medical Association announced that medical physicians who used electromagnetic therapies would lose their license to practice, which at that time was granted by the AMA. So 1934, the machines went in the back room. They got covered up with sheet, and the use of frequencies and the research pretty much stopped. So Harry Van Gelder was an osteopath and naturopath from Australia. He bought a practice in 1946 that came with a machine that was built in 1922. He went in the back room and saw this machine covered up with a sheet and pulled the sheet off of it and decided to try using it. That machine came with a list of frequencies. And so I got the list from him in 1995, started using it in 95 and 96. By 1997, I decided I had to teach FSM to find out whether or not it was reproducible. Were the frequencies actually working because the frequencies were doing it, or were they working because the walls in the clinic were pink and I was a nice guy? The fact of the matter is we really don't know how the frequencies were derived. So all of the research that was done between probably 1905 and 1934 has largely been lost. There may be some people that have found it and saved it, but I've never been able to find much of it. In the rare book room at the Naturopathic College in Portland, we found copies of Electromedical Digest, the electronic reactions of Dr. Abrams, although Abrams' frequencies were only a small part of what we use. So all of that research, how they derived the frequencies, what were they treating them with? What was their research that they shared? There was Electromedical Digest, there was the Pathometric Society, they had meetings, they had journals, they published essays and articles, and all of that's been lost when Grandpa died and Dad died and the machines went and his papers went onto the junk heap. All of that information was lost. We're uncertain of the mechanisms of action, although you're going to hear some ideas about how we think they work, and this hypothesis about the mechanisms of action is finally testable. The 1920s equipment, I know, is not microcurrent. It plugged into the wall back when wall current was direct, before we had AC current at 110 amps. So That's what we know about the development of where the frequencies come from. But how do they work? So what we know in medicine is that inflammation causes all degenerative disease. But on the other hand, what causes inflammation? So infection and injury activate the immune response and change cell signaling. So when you have an infection from a bacteria or a virus, or you have a tissue injury, you cut yourself, you bruise yourself, you break your leg, whatever, the fragments of the bacteria, the viruses, and the damaged cell, the cell debris, activate the immune system cells and modify regulatory mechanisms in the immune system, cause the immune system cells to produce cytokines and inflammatory peptides, lipoxygenase and cyclooxygenase. And when you get better, you should return to health. Those signals should change and the immune system could quiet down. And most of the time, you know that that is what happens. Your wound heals, the redness goes away, the soreness goes away, and inside of 6 weeks, you don't actually, oh yeah, you can remember that you had a cut, but it's hard to find. When your cold goes away after 10 to 14 days, you feel fine. And after a while, you kind of forget what you felt like when you had a cold. But there are times when the immune system doesn't turn off. So people get chronically ill or have non-resolving inflammation. So the short version of what causes inflammation is infection and injury activate immune response and change cell signaling. Those changes in cell signaling change genetic expression. For those of you that are not medically trained or inclined, the genes inside your cells are what make the cells work. So we're used to a gene that makes your eyes blue. Well, there's a gene that makes you, 5'8", and there's a gene that gives you curly hair, and there's a gene that makes your eyes blue. And there are genes that turn on inflammation, okay? Genes are on and off. Your eyes are blue. They're always blue, okay? But there are some genes that turn on and turn off depending on what's going on in the outside environment. We call that epigenetic influences. But so, for example, if you have a bacteria or a virus or a piece of cell debris from a cut, that lands on this receptor on the outside of cells in your body, in your immune system, let's say. And though that receptor, those viruses, bacteria, fragments, or cell debris land on the receptor, turn on these kinases inside the body, turn on the transcription factors that change the genetic expression and create inflammatory cytokines. So the job of anti-inflammatory drugs is to land on this receptor, change it back to the way it was before, turn off the kinases, turn off the transcription factors, and change the genetic expression and turn off the cytokines or locks and cocks. So that's how Advil works, is it lands on these receptors and changes how the cell works, what the genes do for a living, what the genes are producing. Well, in point of fact, the frequencies to reduce inflammation that we use in frequency-specific microcurrent constitute a new tool that we use to reduce inflammation with frequencies. So the frequencies to reduce inflammation reduce lipoxygenase-mediated inflammation by 62% in 4 minutes and COX-mediated inflammation by 30% in 4 minutes and normalize immune system activation. We have research that shows this. So this research trial was done in Sydney, Australia by Vivian Reeve, and they paint arachidonic acid on these little hairless mice. See the mice? The arachidonic acid is painted on the mouse's ears, and then they measure the mouse's ears with these calipers. And so this bar represents how thick the mouse's ears get. So they ran the frequency 40 hertz on channel A and 116 hertz on channel B, the frequency to reduce inflammation, 40 hertz, in the immune system, 116 hertz. And it reduced the swelling in the mouse's ears by 62% in lipoxygenase-mediated inflammation. Then they painted another chemical on the mouse's ears and ran 40 hertz on channel A and 116 hertz on channel B. And that reduced the swelling in COX-mediated inflammation by 30%, which doesn't sound as good, but that's equivalent to the prescription drug Toradol, which is used by injection after you've had surgery to reduce inflammation. And in this particular case, all the animals responded with this 62% reduction in inflammation, 30% reduction in inflammation, in a 4-minute time-dependent response. And this 4 minutes of time represents the amount of time that it takes the genes to change what they're doing and reduce the inflammation. They actually compared it to a placebo, and the placebo didn't do anything. It was equivalent to the control. And so this is not a placebo effect when you're working on a mouse. And then they ran other frequency combinations, and no other frequency reduced swelling in the ears at all. Then they ran other frequencies from our list, reducing mineral deposits in bone. There's no bones in a mouse's ear. Intermediate injury, what we call the intermediate injury. And so not only did plain microcurrent not produce any reduction in swelling, but none of our other frequency combinations produced any reduction in swelling either. So 40 hertz on channel A and 116 hertz on channel B reduced inflammation better than any prescription or non-prescription drug ever tested by this animal model in this lab in Australia. So it's an incredibly powerful tool to reduce inflammation. Well, here's a precaution that we have to observe when we use 40 hertz on channel A and 116 hertz on channel B. 40 hertz changes cell function and turns off inflammation. And this inflammation stays off for about 2 to 6 hours in humans. If you have an infection, the immune system is used to contain infection. That's why an infection, a thorn in your skin or an infection in your skin is red and swollen and it hurts, is because your immune system is attacking it with inflammatory products. You turn that inflammation off, and while the inflammation is off, the infection can proliferate. So we use this frequency to reduce inflammation as an indicator about whether or not there's infection. If 40 hertz increases pain, then we go and check for infection. If the patient's on antibiotics for any infection, then it's okay to treat it. So then they sunburn the mouse. I know, I always feel sorry for the mouse when we get to this slide. Anyway, so if you sunburn a mouse, it increases swelling. If you don't treat the mouse, it increases swelling at 21, 23, 25, and 27 hours. If you treat the mouse immediately with 40 hertz on channel A and 116 hertz on channel B, the swelling goes down, but it's not really that impressive, right? It's not statistically significant. If you wait 2 hours for the sunburn to affect the genetic expression in the cells, the use of 40 hertz on channel A and 116 hertz on channel B reduces the swelling by at 21, 23, 25, and 27 hours in a statistically significant pattern. Looks like it reduces it by about 1/3. So that's kind of cool. 0.05, 0.01 says that this is not chance. This is statistics. It's not chance. We really do reduce swelling with 40 and 116. However, there is an effect of sunburn in mice that is studied with this system. So you paint a contact sensitizing agent on the hind leg at the time of the UV exposure. So you paint this contact sensitizing agent on the hind leg of the mouse at the time of the UV exposure. And then 2 weeks later, you paint it on his ear. And if he hasn't been sunburned, then this is a normal response. So the closer you are to this amount of swelling at 2 weeks, then the closer you are to normal, and the immune system is to normal. However, if you sunburn the mouse and you paint oxazolone on their hind leg before the sunburn, and then you sunburn the mouse, the immune response is suppressed. This IS here stands for immune suppression. The immune response is suppressed by 63%. If you treat them at 2 hours, that immune suppression is reduced from 63 to 57%. That's pretty cool. If you treat them immediately, now remember, this is a group that didn't have a particularly impressive reduction in swelling, but if you treat them immediately, the immune suppression is cut in half from 63 to 31% 2 weeks after a single 4-minute application of a frequency, one and only one frequency for 4 minutes. Exactly. So the immediate FSM treatment changed immune response permanently. So what that suggests is that when we treat with the frequencies to address the immune system, it is possible, based on this research, that we can reduce or change, not reduce, change and help normalize the function of the immune system permanently. That is honestly the most impressive data we have. It's the hardest to understand, it's complicated, but it suggests that the frequencies truly do affect the genetic expression in immune system cells. So inflammatory cytokines are associated with pain in the nervous system, and degeneration in the brain and the joints. All of the neurodegenerative diseases have at their source inflammatory cytokines. The frequencies that we used in one study on fibromyalgia associated with spine trauma reduced inflammatory cytokines by factors of 10 and 20 times, and they all stop in the normal range. This means that the genes making these inflammatory cytokines have turned off. So it's impressive enough to think that we could take 54 fibromyalgia patients. Now, consecutive just means I treated everybody that came in the clinic. I didn't skip somebody because I didn't think we could help them. So 54 patients on a row walked into the clinic over about a 1-year period, and we treated all 54 of them. They had an average pain chronicity of about 9.5 years with a range of 1 to 50 years. So these patients had been in pain with fibromyalgia for a really long time. I took 25 of those cases and presented them at grand rounds at the National Institutes of Health in Washington, D.C. This sample subset, I presented the 25 cases. They were representative in age and chronicity. And out of that 25 cases, a chemist at NIH analyzed blood sample data on a subset of 6 patients. And these patients were likewise representative of the whole group. So we can say pretty much with confidence after 13 years that we can treat successfully fibromyalgia associated specifically with spine trauma. There was a control patient. That patient had myofascial pain from trigger points and didn't actually have fibromyalgia from spine trauma. This group of fibromyalgia patients, there's 30% of them, 30% of fibromyalgia patients in the US, 30% of that, 6 million patients who have fibromyalgia, 2 million of those patients. There's only one frequency combination that is effective in that group, and that is the frequency 40 hertz, the one that reduces inflammation and reduces cytokines, and the spinal cord. If you've got full body pain, the only thing that could make that pain full body, that takes pain signals from the whole body and takes it up to the brain, is the spinal cord. So 40 hertz on channel A and 10 hertz on channel B. And as a group, these people had their pain reduced from an average of a 7.4. They walk in between a 5 and a 9. And they leave between a 0 and a 2. So their pain was reduced from an average of a 7 to an average of 1.3. And 58% of them recovered from fibromyalgia by using FSM in the office. Some of them used a home unit. Most of them got physical therapy. Most of them had a period of reconditioning. We did supplements. We treated their gut and their adrenals and interstitial cystitis. And this is how you hook them up. Current at the neck goes to the feet, through the whole body, but the frequencies address specifically the spinal cord, and there's data to show that. So interleukin-1 is an inflammatory cytokine, and cytokines are known to be hard to change. When you change them with drugs, it takes 2 to 3 months. But in this case, the cytokines changed in 90 minutes. They went from interleukin-1, and this first patient went from 392 down to 21. That p-value has 3 zeros, which means there's absolutely no way that this is coincidence or chance. Cytokines change slowly when they change at all. TNF-alpha went down. TNF-alpha went down from 299 down to 20 in 90 minutes. When you do that with a drug, a prescription drug that is delivered by injection, it takes 30 to 60 days for the TNF-alpha to go down to normal levels from wherever they are. Once again, this is statistically significant. Interleukin-6 is also associated with degenerative diseases in the brain and the gut, and those are the ones I know about. That went from 204 down to 15. So all of these cytokines are created by changes in cell signaling. Something happens in the spinal cord that causes the immune system cells to create inflammatory cytokines. There is absolutely no way that these cytokines are going to go down at that rate unless you change the cell signaling that creates them. And we have data not only on interleukin 1, 6, TNF alpha, we also have interferon gamma and CGRP, which are even harder to change. Substance P goes down by a factor of 10 times, from 132 down to 10, as an average from 180 down to 54, but it's still a little bit above the normal range there. This is in the normal range. And substance P is manufactured in the spinal cord. So this piece of data shows that we actually are addressing the spinal cord with that frequency 10 hertz. Endorphins go up. These patients get so relaxed and euphoric that by, this is 10:50, so at 10 minutes to 11 we started. By 11:30, this patient had her eyes closed and would prefer not to talk. By noon, she was pretty much so stoned that she couldn't talk. She was rousable, and when she left the office at about 1 o'clock, she was just fine. But the endorphins go up, and this is characteristic of treating this group of fibromyalgia patients. Cortisol went up, but that was not a stress response. These patients were not stressed. They were pretty stoned. Cortisol follows endorphins, because if you're going to raise endorphins that high, you're also going to raise the chemical that stimulates the adrenals. So that's where the cortisone came from. The pain went down from an average of a 7 to an average of a 1. That p-value actually has 6 zeros, but anything more than 3 zeros is shown off according to the statistician, so we only published 3. All patients experienced pain relief. 58% recovered from fibromyalgia within 4 months. 13 out of 53 discontinued treatment inside of 1 to 2 months for reasons not related to treatment side effects. When you take somebody from a pain level of a 7 to a 1 in 90 minutes, and when they have been in pain for 15 years, their pain has not been below a 5 for 15 years, it creates an existential crisis that is unparalleled in medicine. So this is data. It's the people who discontinued treatment had the same positive outcomes as the patients who continued it and recovered from fibromyalgia. Recovery from fibromyalgia is never 100%, but these are profound outcomes in a condition that creates the most difficult and perplexing full body pain that physicians ever treat. And this patient recovered in 4 months. She had 14 of 18 tender points in December. She had 7 of 18 tender points in February. And at 6 years, she was still recovered. She was on no medication. She slept well, her digestion improved, and IBS improved. So recovering from fibromyalgia is possible. And it actually becomes what we expect in most cases, especially from spine trauma. There are about 6 other causes of fibromyalgia, and the treatments for them are not so simple. They're more complicated, but it still works. So fibromyalgia, especially fibromyalgia from spine trauma, about 30 to 40% of fibromyalgia patients have this type. And that group we expect to be able to treat, and about 60% of them will stay with the treatment program and get to recovery. So these genes are turned on by injury. So we're talking about genes again, and the genes that are turned on by injury determine the rate of healing. Frequencies and the current change those genes and speed up healing. So we know that microcurrent by itself, just direct current, just DC current, increases cellular energy by 500%. ATP is what your cells use for energy. You increase that cellular energy by 500%, and it provides virtually unlimited energy for healing injuries. So as long as the current is below 500 microamps, you increase ATP, or energy production, by 500%, protein synthesis by 70%, amino acid transport by 40%. This was done in 1982 by Ngoc Cheng, and 2001 and 2002 by Seegers in South Africa, and they were published in Medical Hypothesis and Clinical Orthopedics. So this patient had a 30-mile-an-hour side impact collision. She crawled from the car flipped over. She was 36 years old. She crawled out of the car, called the office, called her husband, went to the hospital, came to my office 4 hours, exactly 4 hours after the accident. And we did an hour-long history and did 2 hours of treatment. We did what we call the new injury protocol and the concussion protocol. Now, her initial symptoms, when she walked in the door 4 hours after the accident, she was already stiff. Her pain level was already a 6, and she already had her range of motion reduced by 50%. So I treated her. We treated her for 2.5 hours. And at the end of that 2.5 hours, I told her that her pain would be worse the next day and worse the day after that, and that it would take her 4 months to recover. So I wasn't painting a rosy placebo effect picture here. She came in the next morning, pain-free, with full range of motion. I absolutely did not believe it. So she came back in, that was a Friday. She came back in on Monday, and sure enough, she still had no pain and full range of motion. Probably the most famous new injury patient was Terrell Owens. So over the years between the 1999 when that patient came in, so over those 5 years, we learned how to treat new injuries. When Terrell Owens fractured his fibula, tore the ligaments that hold the tibia and fibula together, and tore the deltoid ligament off the outside of his ankle on Sunday, December 19, 2004, they called me and said, he wants to play in the Super Bowl in 6 weeks. Can this be done? So he had surgery on the 21st. They called me on Monday, the 20th, and I said, yeah, we can probably do it. So I flew to Philadelphia, treated him literally when he got out of the operating room. We loaded him into the car. He was in a stretch limo, laid out on the seat. I treated him for the 1-hour ride to his house. And then we put him on the couch and I sat up on the couch and I treated him for 24 hours straight to stop the bleeding, stop the inflammation, to repair the torn tissues. He was the next day, the day after the surgery, when his ankle should have been the size of a football, it was completely normal. There was no swelling and no bruising. He was treated 5 to 6 days a week for 5 weeks with FSM. We got to the Super Bowl. The surgeon was saying that the injury should have healed in 13 to 18 weeks, or maybe even never. At 4 weeks, we treated him 5 days a week for 5 weeks, but at 4 weeks, they did a fluoroscopy and ultrasound of the ankle, and it was complete. The fracture was healed and the ankle ligaments were completely stable at 4 weeks. When he got to Jacksonville, though, he couldn't run. I mean, he was still in great condition. They kept him conditioned. The trainers at the Eagles, Rick Burkholder is a genius. And when he got there on Tuesday, he couldn't run because of the scar tissue in his lower leg. The frequencies for reducing scarring are so effective that I wouldn't use them until 6 weeks. So I got to Jacksonville on Wednesday. We treated him for 4.5 hours on Wednesday evening and took out all the scar tissue in his lower leg. Thursday, we treated him for another 2 hours, and then Mike Hatrack came, his chiropractor, and adjusted his ankle. He played in the Super Bowl exactly 6 weeks after this career-ending injury. So how did that happen? Why is it 4 hours? Well, we're back to genes again. These immediate early genes turn on as soon as the injury happens or within the first hour, first 2 hours, and they are off at 4 to 5 to 6 hours. I believe that what we're doing when we turn off the bleeding, turn off the inflammation, is we turn off these early injury genes and we jumpstart healing by 2 to 3 weeks, because injuries heal in roughly half or less than half the time that it takes to do it without microcurrent. So this is after a facelift. It's an 80-minute treatment that was done immediately post-op and daily for 7 days. This is day 1, that's day 2. There's some bruising, some swelling. She's still a little swollen at day 5, but very little bruising on day 6, day 9. Not entirely sure what happened in that picture. But this is day 11. If you've ever seen anybody 11 days after a full facelift, you know they don't look like this. So post-operative healing, delayed onset muscle soreness, when you do unaccustomed exercise. This is a controlled trial done with a placebo control. One leg was treated, one leg was placebo. And these are the frequencies we use. Stop the bleeding, repair the torn tissue, reduce the inflammation, support vitality. And this is what happens. You know that when you exercise and over-exercise, you're going to be sore the next day and worse the day after that. So the sham leg was a 5 out of 10 and the treated leg was a 1. At 48 hours, the sham leg was a 7. That's always the worst, day 2. And the treated leg was a 1. Day 72 hours, the sham leg was a 4 and the treated leg was a less than 1. And point of fact, the thing with delayed onset muscle soreness is there is no effective prevention or treatment. That's the biggest problem with it for athletes and bodybuilders and other people that exercise and work out. And this is the only study we have that compares microcurrent to a non-specific trial done by, can't remember her name, in 1999, that showed that a single channel microcurrent at 0.3 of a hertz and 30 hertz, once again, same current level and same time treatment for 20 minutes used immediately after exercise, did absolutely nothing for delayed onset muscle soreness. Lady's name starts with an A. It's in the published paper. Look for a paper by Denise Curtis in JBMT, published in 2010. Brown recluse spider bite. The surgeon said that the necrosis caused by the spider bite would heal, would require surgery in about 3 to 4 weeks as the tissue died and necrosed. And then at the 2nd month, there would be a 2nd surgery, and then we'd see it the 3rd month, and this wound would heal, but they would have to go in and cut away the dead tissue. So we treated with microcurrent for the blood vessels. The brown recluse venom dissolves the blood vessels and causes the blood to clot and damages the blood supply and the tissue, which makes it necrotic. So here's after 1 treatment. It was about an hour. These are the frequencies I used. The next day, this is what it looked like. So this is all purple and kind of dented in as the tissue is dying. Well, the next day, the tissue isn't dented in, and it's lighter, it's lacier. That really deep red is gone. Here you can see where the bite was. There's that spot and that spot. So this was somebody's leg. He got bit by this spider in his backyard on his farm. And we used the frequency to dissolve this blood clot, dissolve the blood clot, started it bleeding. There's a frequency that stops the bleeding. We used that frequency, turned it off. That was kind of fun. But notice how it's recovering. It's lacy, it's lighter. And then July 23rd, so he had 4 treatments between the time of the bite and July 23rd. August 1st, I thought to ask the patient, well, how's your leg doing? He was seeing me for something else. How's your leg doing? He pulled up his pants leg, rolled down his sock, and that's the skin. No surgery. What is that? 10 days? No additional treatment after the 4th one. If you're doing surgery, post-operative outcomes and C-sections, FSM used immediately after the surgery shortens the hospital stay by about 1/3, almost a half a day, which is good if you're the patient and good if you're the hospital. And it reduces post-op pain, especially when the patient is exercising. So this study was done by John Cale in 2013. It's not published yet, but he's still working on it. Diabetic peripheral neuropathies. You all know that diabetic wounds get infected. This is necrosis. And the end of this toe is dead, dying. This one is about to die. So these 2 toes, they were waiting to amputate them. And the patient went to an FSM practitioner and said, well, can you treat this thing? So he had a 7-centimeter ulcer on the side of his leg. That was fixed in about 2 weeks. See the edema in the leg. He had sensation loss in 7 out of 10 areas, and all of this was healed in 6 weeks. This wound was healed in 6 treatments. The necrotic toe was healed in 11 treatments. So this is what it looked like in 20 days, and then she treated him for another week. So the sensation became normal within a month. Not many diabetics have that happen. So wound healing is profound. So here's a question. When is a new injury not a new injury, right? So there is a frequency protocol that is useful for shingles, only shingles. That's all it's good for, is shingles. There are some patients who show up with a rash, like this gentleman. He was 85 years old. He had a rash on his head, and his dermatologist said that it was actinic keratosis, which is a precancerous inflammatory condition that is treated with inflammation. Well, I treated it for about 5 minutes with the frequency to reduce inflammation, and his pain went up. Well, the only time the pain goes up when you reduce inflammation is when there's an infection. So I took the contact off of his head, looked at his head again, and decided that this was shingles, which in an 85-year-old man in the ophthalmic branch of the fifth cranial nerve is really serious. This is what they die of. This is what they die with. This does not get better. So I treated him for 4 hours, 1 hour immediately upon discovery, then another 2 hours later in the day, another 2 hours the next day. He was pain-free after the first hour, but I kept treating him because this condition is so serious in somebody his age. He had no return of pain, and the lesions were gone in 48 hours. I published this paper in 2010 in Practical Pain Management, and it's titled The Non-Pharmacologic Treatment of Shingles. There is no way to get rid of shingles in 2 to 4 hours, and it's routine. These frequencies are extraordinary. So frequencies and genes, well, frequencies change genes and speed up healing. They kill viruses, they reduce inflammation. How does that happen? I mean, think about it. How does that happen? How do frequencies change your genes, right? Well, this is my hypothesis. The human body is a quantum biological system. You are, a biological system. Living tissue, your body, is biochemicals. Okay, as a body, you follow the rules of physics, of Newtonian physics. If we drop you off a building, you accelerate at 32 feet per second until you hit the ground. But Newtonian physics falls apart at the atomic and subatomic level. So let's just go back a level from your body falling from a building, from Newtonian physics. Let's look at your body as a quantum biological system. Living tissue is biochemicals. Okay, what are biochemicals? Biochemicals are molecules that are hooked together with bonds. If you look up things on the internet, you will see what the chemicals in your body look like and how they're hooked together. They're molecules held together by electromagnetic bonds. What are the molecules made of? Atoms. They don't have special atoms for bodies. It's the same atom that runs around in the linear accelerator in Chicago or Europe at CERN. Same atoms. What are those atoms made of? Same thing they're made of in Chicago and at CERN. Subatomic particles. How do they hang together? How are they bonded together? Well, they're held together by bonds. What kind of bonds? Electromagnetic bonds, which I don't totally understand, and you don't have to either unless you already understand that, at which point you're ahead of me by ways. So they're held together by electromagnetic bonds. I think of it like magnets. If you have a positive magnet, negative magnet, you hook them together, they hook together. Okay. In chemistry and biology and physics, bridges, roads, chemicals, lead crystal, every bond has a frequency at which it resonates. That is, where a very small input of energy at exactly the right frequency will resonate with that bond and cause it to vibrate. Okay? So we're going to come back to this resonating the bond and vibrating concept. Hold that thought for a second. So your body is an electromagnetic system filled with electromagnetic bonds, and you look solid, right? You really do. But those cells have more space inside of in between the molecules and atoms than there is stuff. And the cells in your body function as if they are a semiconductor network. You have water molecules that line all of these membranes and cells in your body, and they vibrate, they flicker. And when they flicker, they create this little hole that makes your body, for all intents and purposes, like one big or billions of little semiconductor chips It's like your silicon or germanium chips, gazillions of them, right? Those semiconductor chips convey current. Becker found that you're more positive at the top and negative at the bottom, more positive centrally, more negative distally. And if you measure current between your middle and your fingers, there's going to be a change in charge. There are certain enzymes and signaling in your body that happen faster than a nerve impulse. Nerve impulses are too slow. These are energetic information transfers that happen in between parts of the body. So I recommend to you Robert Becker, The Body Electric, and James Oshman, Energy Medicine, The Scientific Basis. The second edition is brilliant. And I recommend to you Pollack's book on cells, gels, and the engines of life. It's about your body as a semiconductor network. It's brilliant. So the immediate effects of the frequencies, the fact that you can reduce inflammation by 62% in 4 minutes, starting now. Resonance, this biologic resonance, explains the immediate effects. Resonance is the tendency of a system or a bond to oscillate at large amplitudes in response to some frequencies and not others. Everybody pretty much knows that when an army crosses a bridge, they don't stay in step. They don't stay in step because the resonance of their regular matched footsteps, that resonance can match literally the resonance that holds that bridge together, and the bridges fall down. It happened. So a long time ago, they learned to break step when they get to a bridge and not be in step, so that frequency resonance won't take the bridge down. So at a resonant frequency, these footsteps, these small forces, can produce very large vibrations and large amplitude vibrations, enough to take apart a bridge. But the one we're probably more familiar with is that trick where the singer, Julie Andrews is the one that comes to mind, in Victor Victoria, she sings a note that breaks a lead crystal glass. How does she do that? That isn't volume. My chemistry teacher explained how that worked. There is a precise note that matches the frequency that holds lead atoms together in a crystal matrix. It only works with lead crystal, about 70%, I think. That's the percentage. Only works with lead crystal. The note has to match exactly the frequency that holds lead atoms together. The lead atom bonds vibrate with the singer's note, and the lead crystal simply comes apart. Okay, so how do frequencies work? Biologic resonance explains the effects on living tissue. We're used to drugs and nutrients. Advil lands on this receptor, so you have tissue injury or virus or bacteria that lands on this receptor, turns on inflammatory cytokines and lipoxygenase and cyclooxygenase inflammation. Advil or other medications land on this receptor and turn it off. Like a key in a lock, the drug lands on the receptor like a key in a lock and turns off the inflammation. Well, you use resonance all the time. Every time you use your key fob to open that same lock on your car door, you're using resonance. This is just biologic resonance. And it explains the effects we observe in clinical practice and in research on living tissue. The frequencies act like your key fob, opening this same lock, changing this same receptor, and changing membrane, protein, receptor configuration, and cell function electromagnetically. It acts as if it changes cell signaling to reduce inflammation. When we dissolve scar tissue, Terrell Owens, I didn't treat him until the 6th week. Why? Because we dissolve, the frequencies dissolve scar tissue cross links, and once they're dissolved, it takes too long to put them back. So we don't treat with the frequencies for scar tissue until the injury is 6 weeks old. In shingles, it acts as if it disassembles the virus capsid. In new injuries, it changes cell signaling and accelerates the healing process dramatically. Okay? Makes it sound pretty magic, doesn't it? It kind of is close to reproducible magic. But there are things it can't do. You can't fix everything in everybody. It is as good as it sounds, but it's not a panacea. It's biophysics. and it's medicine. But in point of fact, it can't treat what you don't think about. It will treat exactly and only what you, the practitioner, choose. And that can cause the results to vary. If the problem is not emotional and the practitioner only treats emotions, it's not going to work. If the problem is not toxicity and the practitioner is convinced that everything is caused by toxicity, it's not going to work. If the problem is not the muscle and you only treat the muscle, it's not going to work. So the challenge that we have with FSM is that it requires a thoughtful, educated practitioner that can learn to think outside the box. And thinking is what makes FSM practitioners different than maybe other practitioners. Everybody has to think. But the frequency response makes you think about injury and recovery and every condition you treat differently. For example, if you have a weak glute maximus, that gluteus maximus, that muscle in your butt that extends your hip, and that muscle is weak, and that leads you to have injuries in your hamstrings, okay? You can treat the hamstring and the glute, but that's not the problem. What we found over time is that the reason that the glute maximus is turned off is that the cerebellum inhibits the motor activity of the glute because the muscles in the front of your leg are adhered or stuck to the nerves in the front. So you have a little groin injury, you have a bruise, you have a whatever, it sticks the nerves to the muscles in the front. Well, your cerebellum is not going to let you do anything that will injure this nerve because, you know, nerves are important. So the best way to protect that nerve is to turn off the glute, which would stretch this in the front. So the way to treat the weak glute is not to treat the muscle. The way to treat the weak glute is to eliminate the scar tissue between the nerve and the fascia in the front. So you use the frequency to reduce scarring, 13 hertz, with the frequency for 396 hertz, the nerve. And you mobilize that, and the glute goes back to full function instantly. So FSM is taught as a 4-day course, but the course is just the beginning. The frequency response teaches you everything you need to know. Unless you had a way to dissolve adhesions between the nerve and the fascia, and you don't unless you use FSM, how would you ever know that these adhesions are causing the weak glute max and this muscle inhibition, which you thought was weakness? Unless you had a way to remove trauma from various tissues, how would you ever think that it caused muscle spasm? This line is from a slide that I deleted from the protocol. If you want to read about FSM, read The Resonance Effect. It is the most readable, easy explanation of what FSM does, how it was developed. Jim Oshman was very kind. He says it's a can't put it down page turner of a book. He described it as fascinating, funny, inspired, exciting, and altogether delightful. We talk about how FSM started, what it does, and how it works. And you can go to the frequencyspecific.com website. The Resonance Effect is available on the Frequency Specific website, or it's available on Amazon. There's a Frequency Specific Microcurrent and Pain Management textbook. It's about 8 years old now and slightly outdated, but still gives you the basics for those of you that are practitioners. In 2018, we have 4-day seminars all over the US. We have a seminar in Philadelphia, June 21st to the 24th, that's not the 14th, 21st to the 24th, in Denver, July 26th to 29th. In London, we will be at the Osteopathic College on September 13th to 16th. There's a seminar in Germany, June 4th, 5th through the 8th. So I have to warn you that the Frequency Specific Microcurrent seminar will change your life forever. If you're a patient, Frequency Specific Microcurrent has the potential to change your life in ways you could never imagine. If you're a practitioner, using Frequency Specific Microcurrent will allow you to do things that you can't now possibly imagine. The Frequency Specific Microcurrent will change your life forever. Join us, see it for yourself. Come to www.frequencyspecific.com, and we'll talk to you next month. Thanks for joining us.